How y'all doing today? My name is Matthew Dilly, and come to talk to you about the cost of negativity. Have y'all ever heard, if you don't have anything nice to say, don't say anything at all?
Mm-hmm.
Yep, me too. We all know that, being negative causes trouble, but how much trouble does it really cause? Have you ever missed work, missed a due date or a homework assignment? Have you ever felt overwhelmed by stress to miss something you're supposed to do? After extensive research, I feel confident that I can illustrate the cost of negativity at work, at home, and in the healthcare field. First, I'm going to start with how attitudes affect the workplace. Dr. Roche states that job stress costs the U.S. economy $300 billion per year. Absenteeism, for example, someone not showing up to work on a day they're scheduled, happens on average 1 million times per day. Now here is a graph from the Bureau of Labor Statistics that states work-related homicides by type of assailant and gender. Now, this one is supposed to say coworker or work associate, and out of the 500 work-related homicides in 2016, 66 were caused by coworkers or work associates. The American Psychiatric Association claims that workplace stress causes about 120,000 deaths a year. Negativity obviously causes trouble in the workplace, but it also causes trouble with our personal health. I interviewed a local MD, Dr. Mark Lowry, who's been a practicing pediatrician for 19 years. I asked him specifically, did you ever notice a connection between patient attitude and overall health? And this is his answer word for word. Yes, quite so. Anxiety as a negative emotion can magnify symptoms. An anxious patient will feel pain worse and have a hard time feeling recovered. He also found that belief in whether a treatment would work or not had an effect on adherence to the treatment. Patients that believed asthma treatment would help their child would follow along with the treatment plan, and the child would have less incidence than children whose parents did not believe it would work and therefore wouldn't follow the treatment as well as someone else. They had higher incident rates of asthma attacks and ER visits and doctor visits for it. Now, connected to that, the 2014 drug trend report estimated that medication non-adherence, or not taking medication as prescribed, causes about $333 billion a year in medical complications. If it's this bad patient to patient, how do you think it affects healthcare as a whole? Stress is a contributing factor in many leading causes of death, according to the CDC. According to a National Vital Statistics report in 2017, suicide was a leading cause of death. You do. Now here's a graph of heart disease death rates 2014 and 2016 by the CDC. The reason why I show you this graph for heart disease is because heart disease is the leading cause of death in the U.S. and has been for a long time. Also, according to the CDC, heart disease costs us about $200 billion annually. They also state that asthma costs us about $80 billion annually, and obesity costs the healthcare system $147 billion annually. Research done by Bonafed et al. Claims that migraines cost the healthcare industry $36 billion annually, and research done by Greenberg et al. Claims that depression costs us about $200 billion annually. These 5 medical conditions, which are just 5 out of the whole list, that's just the cost for them. Now, looking at a graph of the cost in billions of all these different things, we have medication non-adherence at $330 billion, job stress at $300 billion, heart disease at $200 billion, asthma at $80 billion, obesity at $147, migraines at $36, and depression and anxiety at $200 billion. These 5 medical complications are totaled at $663 billion, and all of them reach a combined total of $1.293 trillion. This is just a small amount of examples of how stress and negativity costs the economy money. As you can see, this money in billions, but in total trillions, compared to the national debt, which is this big, huge number we all worry about from time to time. U.S. national debt is $14.294 trillion. And these small costs of negativity totaled at $1.293 trillion annually, which is about a little over 9% of the national debt each year. So, with that being said, this is my call to action. Every day we make efforts to do better at work, to do better in school, and to make positive changes in order to benefit our lives. Today, I ask that we make a change not just in our actions, but in our attitudes. Now is the time to make an effort to nurture more positive attitudes. Not just our lives, but our bank accounts depend on it.